Okay, if you're a parent, a caregiver, anyone who looks after a child, this is for you. We're talking about one of the most critical skills you can have, spotting dehydration. It's such a common problem, but it can get really serious really fast. So in the next few minutes, we're going to break down exactly what to look for and what to do so you can feel confident you're ready.
So here's what we're going to cover. First, we'll get into why kids are so much more susceptible to dehydration. Then, we'll look at the two big causes. And then, this is the really important part, we'll dive into the warning signs you can spot right at home. After that, we'll map out a clear action plan, and we'll finish up with some simple tips to keep your little ones hydrated in the first place. All right, so let's jump right in. Why are we focusing just on kids? Well, it's because their bodies are not just tiny adult bodies. Not at all. They handle fluids completely differently, and that's a really crucial thing to understand. And that really brings us to the big question, right? Why is dehydration so much more dangerous for a child? A simple stomach bug might knock an adult out for a day, but for a kid, it can be a whole different ballgame. Getting a grip on this difference is everything. At its core, the definition is super simple. Dehydration is just when more fluid is going out than is coming in. That's it. I like to think of it like a bank account for water. An adult, we've got pretty big reserves. It takes a lot to drain that account. But a child, their account is much smaller, and it can get emptied frighteningly fast. So here are the big reasons why they're at such high risk. First off, their little bodies are like these high-revving engines. Their metabolism is way faster, so they just burn through water more quickly. Second, a baby or a toddler can't just say, "Hey, I'm thirsty." They can't communicate that need effectively. And finally, believe it or not, their bodies are proportionally made up of more water than an adult's. So when they get sick with something common like a fever or vomiting, poof, those reserves can disappear in a flash. Okay, so keeping all those risk factors in mind, when you look at how dehydration actually happens, it really just comes down to two main problems. It's all about that fluid balance we were just talking about. You can think of it like a really basic plumbing issue. It's one of two things. Either not enough is coming in through the tap, or way too much is going out the drain. And of course, when a child is sick, you often get that dangerous 1-2 punch of both happening at the same time. So let's look at the not enough coming inside. A huge factor here is just plain discomfort. I mean, if a kid has a sore throat from tonsillitis or ulcers in their mouth, it literally hurts to swallow anything. Or if they're having trouble breathing, they just can't physically stop to drink. And while it's less common, other things like structural issues or, sadly, neglect can be causes too. But honestly, the much more common reason is the other side of the equation: excessive loss. The number one cause, and this is worldwide, is that dreaded stomach bug, gastroenteritis, with all the vomiting and diarrhea that comes with it. But you've also got to think about things like high fevers, or even just a kid playing really hard outside on a super hot day. All of those things can drain those fluid reserves way faster than you might think. Okay, listen up, because this next part is, without a doubt, the most important section we're going to cover. We are talking about the warning signs. Seriously, knowing these is like having a superpower as a caregiver. It lets you spot the problem early and know exactly what to do. Now, it's really important to know that dehydration isn't just on or off. It's a spectrum. It's a progression. You start at the baseline, no dehydration. Then it can move into clinical dehydration, which is where the signs start to get pretty obvious. And from there, it can escalate to the most serious stage, clinical shock, which is a genuine, life-threatening emergency. This chart here lays it all out, and you can really see how things escalate. Look at the pattern. It often starts with their behavior. They go from being alert and happy to being really irritable or lethargic. Then you start to see the physical signs. Fewer wet diapers, their eyes might look a bit sunken, their mouth is dry. As it gets worse, the body starts to work overtime to compensate. That's when you see a faster heart rate, which is called tachycardia. And then you get to that final, most severe stage, clinical shock. That's when you see a decreased level of consciousness and their skin can get cold, pale, or even mottled. Okay, these right here are the big red flags. If you see any of these, if the child just seems really unwell or is getting worse, if they're super irritable or sleepy, if their eyes are sunken, if their heart is racing or they're breathing really fast, you do not wait. That is your signal to get medical help right away. And one classic sign doctors look for is something called reduced skin turgor. It's when you gently pinch the skin on their tummy, and instead of snapping right back, it kind of stays tented up for a second. All right, so you've spotted some of the signs. The big question is, now what do you do? This is your game plan. It's all about knowing the right steps to take and, just as important,
knowing when it's time to take them.
For most mild or moderate cases, the answer is oral rehydration. And let me be clear, this isn't just giving them water. We're talking about a special oral rehydration solution, an ORS, that has the perfect balance of electrolytes and sugar. And the trick is to give it in small, frequent amounts, a little bit often. Now, IV fluids, that's for the severe cases. That's a hospital job, for when a child is in shock, has those red flags we talked about, or just can't. So just to really hammer this point home, IV fluids are needed when shock is in the picture, when you see those red flag symptoms, if the child is getting worse, even with oral therapy, or if they're vomiting so much that they can't keep the oral solution down. So in that emergency scenario, that clinical shock situation, the very first thing the medical team is going to do is give what's called a fluid bolus. It's a rapid infusion of fluids, usually saline, straight through an IV. The goal is simple: get fluid volume back into their system fast to restore circulation. This is an absolutely critical, life-saving procedure that happens in the hospital. Okay, so once the immediate danger has passed and the child is more stable, the hospital team gets really precise. They use a formula to calculate the exact amount of fluid the child has lost. This isn't guesswork. It lets them create a very specific plan to replace that fluid deficit, usually slowly and safely over the next 24 to 48 hours. So to put some real numbers to that, let's take a 12-kilo child who's about 10% dehydrated. The calculation shows they're down by about 1,200 milliliters. That's the deficit. So the plan would be to give them that 1,200 ml back, on top of their normal daily fluids, spread out over 2 days. This slow and steady approach is the safest way to get their body back in balance. All right, we're heading into the home stretch, and this section is all about the best strategy there is: prevention. How can we get ahead of this problem so we don't even have to worry about it? Let's talk about that. It can be really helpful just to have a ballpark idea of how much fluid your child needs on a regular day. There's actually a standard medical formula for this, which we've put up here. It looks a bit complicated, but it's pretty straightforward. For a 25-kilo kid, for example, you're aiming for about 1,600 milliliters, or 1.6 liters, over the course of a whole day. And remember, that includes fluids from food, too. Okay, so after a child has been sick and is rehydrated, what's next? Well, you want to get them back to their usual routine. So encourage breastfeeding, other milk feeds, and just regular fluid intake. One thing to steer clear of, though, are things like fruit juices and fizzy drinks. The high sugar content can actually make diarrhea worse sometimes. And here is an absolutely brilliant tip from the official guidelines. For kids who are at higher risk, say an infant, you can actually give them a small amount of that oral rehydration solution after every large watery stool. It's a fantastic way to prevent the whole cycle from starting over again. And really, that's what this all boils down to. The best treatment for dehydration is, and always will be, prevention. Your most powerful tools are knowledge and confidence. So know the signs, be ready to act quickly, and maybe most importantly of all, always, always trust your gut. If you're worried something isn't right, get it checked out. Thanks so much for joining me for this.